A perforated bowel is a serious medical condition that involves a hole or tear in the wall of the gastrointestinal tract, leading to the leakage of intestinal contents into the abdominal cavity. This can cause peritonitis, a life-threatening infection of the abdominal cavity. The condition requires immediate medical attention to prevent severe complications and ensure the best possible outcome. Perforated bowel can occur in various parts of the gastrointestinal tract, including the stomach, small intestine, and large intestine. Types of perforations include those caused by trauma, such as injuries from accidents or surgery, and those resulting from diseases, such as peptic ulcers, diverticulitis, Crohn's disease, and colorectal cancer. Each type of perforation can present differently and requires specific treatment approaches. The causes of a perforated bowel are diverse. In addition to trauma and disease, certain risk factors can increase the likelihood of developing a perforation. These risk factors include chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, steroid medications, and conditions that cause severe inflammation of the gastrointestinal tract. Infections, such as appendicitis or severe gastrointestinal infections, can also lead to perforations. Advanced age, a history of gastrointestinal diseases, and previous abdominal surgeries are additional risk factors. Symptoms of a perforated bowel are often severe and sudden. They typically include acute, intense abdominal pain, which may spread throughout the abdomen. Other symptoms include nausea, vomiting, fever, chills, and signs of septic shock, such as low blood pressure and rapid heart rate. The abdomen may also become distended and tender to the touch. These symptoms necessitate urgent medical evaluation and intervention. Treatment options for a perforated bowel primarily involve emergency surgery to repair the perforation and clean the abdominal cavity to prevent or treat peritonitis. The specific surgical approach depends on the location and cause of the perforation. In some cases, a segment of the bowel may need to be removed, and a temporary or permanent colostomy or ileostomy may be required. In addition to surgery, broad-spectrum antibiotics are administered to combat infection and prevent sepsis. Surgical management of a perforated bowel involves various techniques depending on the perforation size, location, and underlying cause. The primary goal of surgery is to close the perforation, remove any non-viable tissue, and thoroughly clean the abdominal cavity. In cases where the perforation is small and the surrounding tissue is healthy, a simple suturing of the perforation may suffice. However, if there is significant infection or necrosis, more extensive resection of the affected bowel segment is necessary. The patient may also require a stoma, where the bowel is diverted to an opening in the abdomen to allow waste to exit the body into a bag. A comprehensive nursing care plan for patients with a perforated bowel focuses on preoperative and postoperative care. Preoperatively, nurses must monitor the patient's vital signs, manage pain, and ensure that the patient is prepared for surgery. This includes administering intravenous fluids and antibiotics, as well as providing emotional support. Postoperatively, nursing care involves monitoring for signs of infection, managing pain, and supporting the patient's recovery process. This includes wound care, stoma care if applicable, and education on dietary changes and activity restrictions during recovery. Nurses also play a crucial role in monitoring for complications such as abscesses, fistulas, and recurrent perforations. In conclusion, a perforated bowel is a critical condition that requires prompt diagnosis and intervention. Understanding the types, causes, risk factors, symptoms, treatment options, surgical management, and nursing care plans is essential for healthcare providers to deliver effective care and improve patient outcomes. Prompt surgical intervention and comprehensive nursing care are vital to managing this condition and preventing severe complications. Subscribe us and visit our website bazaarbiblio.com for notes and free PDF books.